Good afternoon. My name is Dr. Veronica Peniotu, and I am the Advocacy and Program Manager at the National Coalition for Cancer Survivorship. We want to thank you for joining us today. This webinar is a part of our Survivorship Champion series. Our focus is to support those that are providing survivorship care across the nation, and to have a platform where you can share your resources and research, just like our presenters are excited to do today. Without further ado, I would like to hand this over to the team at the Healing Works Foundation to kick us off.
Thank you, Veronica. It's nice to see everyone today, and I'm really happy to be here. I know Dr. McManamon and myself are both really excited to present about integrative oncology to this NCCS audience. So I am just going to pull up the presentation and we will get started. All right, so I just want to mention off the top here, this is a presentation about integrative oncology. It is germane to both people who are going through cancer right now, people who are in survivorship, and really all of the people that surround people affected by cancer. So your caregivers, your healthcare team, and even if you're not, if you happen to be listening to this and don't have cancer somewhere in your life, I think you might be able to get something out of this in the realm of general wellness. So I'm going to take us through today the first half, and then my partner, Dr. Alyssa McManamon, will take us through the second half. We'll do some quick introductions, a warm-up exercise, and I'll take you just through a little bit of what is integrative oncology, and then some survey results from research that we have done through the Healing Works Foundation over the past couple of years from both patients and physicians. And then Dr. McManamon will take over to talk about making integrative oncology the norm. And we are going to leave about 10 or 15 minutes at the end for Q&A. So I do encourage you, if you have questions as we're going, to please put them in the chat. And Veronica is going to help us sort of watch those questions, and she'll help us answer as many as we can at the end of the talk. All right, so let me introduce myself quickly since I haven't done that yet. My name is Terri Crudup. I am both a patient advocate as well as I work for, I'm an integrative oncology patient advocate, I should say. And I work for a company called Evidation Health, and I will come back toward the end of my section and talk a little bit more about Evidation and how it fits into the integrative oncology picture. And Dr. McManamon will introduce herself when she gets to her section. All right, so a little bit more about me. I have been in the pharmaceutical industry for 20 years. I've been a researcher, also a team lead and a business developer. I also am a two-time breast cancer survivor. And so you can see from the pictures there, I like to show when I talk to patients to encourage your hair does grow back if you've gone through chemo and lost your hair. It might look a little weird when it's coming back, like my mad scientist hair there. But that was kind of my journey. There's a lot of pictures there of my family and my friends, hugely important, that support network to getting through to survivorship. I also champion for increased education, access, and funding of integrative oncology. And we're going to talk about all three of those things as part of the research that we did as we go through this presentation. I did lead the survey-based research that you're going to see in a minute, along with the Healing Works Foundation team. And we've been collaborating for many years together. All right, so enough about me. Let's do a little warm-up exercise. I hope that everyone has access to the chat, because we wanted to take just a couple of minutes and ask everyone to put on your thinking hats, but don't think too hard. We're just looking for gut reactions here. What I want to ask people is, what's the first word, phrase, or feeling that comes into your mind when you hear the term integrative oncology? So again, don't think too hard. Just take a minute. And there's no right or wrong answers. We're just curious what's already out there among the people that we're talking to. Just going to give it a minute to let everyone respond. And I can't see the chat myself right now based on my IT setup. So I'm just going to go with letting Veronica look through those. And we will kind of see what we can do throughout the presentation about how you guys all did. And you can certainly keep answering as we're going. Alyssa, anything to add about what's coming through before I move on real quickly?
It's really mind expanding because people are having a lot of different ways to approach it. But I mean, in the beginning, there was a lot of holistic but I loved some of the things like trust and coordination. Everything has a place. I mean, there's just been some lovely things coming through to really think about what this is.
Awesome. Okay. All right. So let me move on to a generally accepted definition. I think as Alyssa is saying, there's a lot that goes into integrative oncology and at a higher level, whole person care. But let me give you just a quick kind of level setting here. So there's a recent publication from a physician from the Society for Integrative Oncology and the team, where it's generally now accepted that it's a patient-centered, evidence-informed field of cancer care that uses mind-body practices, natural products, and/or lifestyle modifications alongside from different traditions alongside conventional cancer treatment. So that's a lot of words. So let me just break that down. And I think the diagram might help a little bit as well. The most important thing to remember here is it's the and. So it's your medical treatments like surgery, chemo, radiation, hormone therapy, targeted therapy, immunotherapy, all of that. Add to that things that you can do to help yourself and really empower your own health and wellness as you're going through treatment or into survivorship. And so we call those things complementary therapies as a general umbrella term. I broke them down in this diagram to complementary and lifestyle. Some things are a little bit more involved in terms of lifestyle changes like exercise and nutrition. But there's also a lot of complementary therapies that I'll just use that term generally here to encompass both complementary and lifestyle. And when Alyssa talks in a little bit, she'll bring in some of the self-care elements as well. So the panel that just populated on the left are the complementary and lifestyle therapies we researched in the study that you're going to see today. So we wanted to call those 12 out specifically. And you can see they range from nutrition, exercise, which I mentioned, meditation, acupuncture, massage, music therapy, support groups, mental health therapy, Reiki, spiritual services, Tai Chi, Qigong, and yoga. There's a lot in that. There's a lot of different approaches. And I think that's one of the beautiful things about integrative oncology is you can find what works for you. And those aren't all of them. You're probably listening to this and thinking, I tried something else, or I know of something else. There are a lot more. We added some more in this other complementary modalities panel here, but there's even more than this. So I'll let everyone kind of peruse that list. And just all to say, I think at the end of the day, what I talk about specifically is trying to find balance for your mind, your body, and your soul. And there's different ways to get at that. And it's really about kind of finding what works for you. But do consult your doctor, please. I'm not a doctor. And although Alyssa, Dr. McManamon is, it's still important to have your own personal discussion with your physician if you're thinking about making any changes like that. There's a lot of benefits to integrative oncology, and I'm going to show you some of those as we go through the research today. So this is a really quick overview of how the research was done, and I'm just going to point out a couple of things here. One is we've got two different waves of research. One is 2022, the other is 2023. So we're able to look at trends from the year that passed between those to see if things are increasing or decreasing or steady state. We interviewed over 150 oncologists and over 1,000 cancer patients for each wave. And it's really important, the word representative is shown there, 153 representative oncologists and 1,004 representative patients. We took great care to make sure we were surveying across the United States in a balanced way. So one note, this is US specific, so apologies to anyone ex-US. This research for budget reasons had to focus on the US. However, the themes, I think, extend to other countries. And the representative part means that we made sure it's not just like all doctors of a certain age or all patients who are from the Northeast. It's across the United States. It's across ages. We even sampled very carefully for urban, suburban, rural to make sure we were looking at the differences in those. And ethnicity as well, to make sure we were capturing all ethnicities in a representative way and being able to look for differences across ethnicities. So I'm not able to show you all of that information today in a short presentation, but there is a link in the deck at the bottom, and you will receive this deck or have access to it afterwards, where you can click and see the full report if you're interested on the HealingWorks site. All right, so before I show some data, I just want to go through some key takeaways. I think it's important just to know like what's the big picture here that we're finding from this research. So the first thing is that many people they're affected by cancer do add complementary therapies to their conventional medical treatments, and they believe that this combination is improving side effect management and overall well-being. So I can tell you there's a lot of data that supports those statements about improving side effect management, improving well-being, improving other aspects of your health, including contributing to increased odds of survival. But I think the important part here is there's a lot of people that already do it and already believe in it as well. Interestingly, nearly 2/3 of people affected by cancer are using an integrative approach. Again, this is in the United States, but their doctors are not always aware, and the oncologists actually severely underestimate patient interest. So you guys are going to hear me say this several times, that there is a communication gap or an awareness gap, really, for the treating doctors, and it would help if they knew more about patient interest and about patients using these therapies. So keep that in mind as we're going through and looking at the results. And finally, there are challenges. If this was easy, it would be done more. Patients and oncologists both agree that funding is one of the big challenges to increase usage and access to complementary therapies. And then even backing up from that, just awareness and knowing where to go to get them, how to access them, and practical questions from the institutional standpoint, from the hospital standpoint, that they bring up, and I'll show you some of the data around their barriers and what needs to be overcome. The good news is we've got a lot of good people working on this, pushing forward and helping institutions overcome these things. So we will show you some of that as well today. All right, data. So I've been a researcher for a long time, so like many of you, I love data. So I'm just going to show you a few slides today, and I'll orient you to kind of how you can read and understand this data. So you'll see we've got two columns. One is patients, and the other is oncologists. Patients in purple, oncologists on the right in blue. The numbers that you see here, I'll kind of interpret for you in just a minute what those percentages mean, but the arrows themselves, they represent a change year on year. So I'm showing you 2023 data. The arrows represent how that changed from 2022. And you can see here, for example, in the patient column, their attitudes are increasing over time. So what we're doing here is asking, again, in a survey, patients and oncologists separately. So these are two totally separate surveys. We just ask the same questions so we can match them up and see how they compare. And we ask things like, complementary therapies are effective at helping people with cancer manage the side effects of medical treatment. And all we're asking is, do you agree or disagree? 1 is I do not agree at all. 7 is I strongly agree. And the data that we show here is a 6 or a 7. So that's strongly agree category plus the 1 down from it. We call that the top 2 box. So people who answered a 6 or a 7 on these scales is what's shown for all of this data here. We're not showing people who disagreed, but I will note there were very small percentages of disagree in these statements in general. And the one I mentioned about side effects, you can see over half of patients strongly agree with that statement, and over half of oncologists also strongly agree with that statement. Oncologists trending down a little bit year on year, but patients trending up. The other 2 statements here are about the integrative approach improving overall well-being. And you can see there again, more than half of patients and oncologists strongly agree with that statement. And the bottom one, we pushed it 1 step further and said, using the integrative approach, again, medical plus complementary, is effective at improving cancer patients' overall survival compared to just using medical treatments alone. And there we've got nearly half of patients strongly agreeing with that statement, again, trending up over time, and 33% of oncologists agreeing with that statement. And even though 33% is a smaller number relative to others on the screen, I think like if you put that in context, like think about this, this is over 150 doctors from all across the United States representing oncologists, not just ones who are, at those institutions that already have a lot of integrative medicine, but all types of institutions. And 1 in every 3 of them believes this is impacting survival. Again, there's a lot of data to back that up, but I think that it's huge finding just to know that we're already there with 1 in every 3 doctors, and I'm hoping that's going up over time. So I'll switch to a little bit of a deeper dive on those complementary therapies. And I'm just going to reiterate, these are 12 that were picked for this research because they were in the literature. They were some of the more common ones that were used. Not the only ones. They were either common or emerging, and we had to cut the list off somewhere. So of the 12 that we tested, we asked patients, which did you use, if any, as part of your cancer treatment? So this isn't just to say, you know, I exercise or I care about my nutrition. It's actually, have you used it as part of your cancer treatment? And we can see here that those are some of the top answers. Nutrition is certainly the one. 37% of oncology patients saying, yes, I did use some form of nutrition consultation or paying attention to nutrition as I was going through treatment. And then after that, there's a whole bunch here that are about a quarter of patients. Some mental health support or therapy, meditation and mindfulness we grouped together, exercise consultation, spiritual services, and patient support groups. Those are kind of the top answers. And then you can see there's some usage from all of the other complementary therapies. And I'll mention here these top 6 that showed up in that higher percentage. Couple things. One is I used 5 of the 6 in my own treatment, and I continue to use them to this day. I'm 5 years out from my second diagnosis. I think they're a nice balance across. I talked about mind, body, and soul. There's those 6 kind of capture all 3 of those, and some of them are free. So I think, like, I know resources is always a question, but meditation and mindfulness can cost you nothing. There are ways to do meditation that would cost money. Spiritual services, for the most part, are free, and patient support groups are usually also free. Some of the others you might be able to get as well, and we're going to talk more about resources at the end, so I won't steal all of Alyssa's thunder. But just to say, like, it's a consideration, and there are ways to do this that are not a huge drain on the pocket. So we asked patients, are you using these therapies, the complementary therapies? But we also asked them, do you think that your health system should offer more? And health system is just a fancy name for hospital, wherever you went to get treated. And 71% of patients said, yes, I think my hospital should have offered me more as a cancer patient. And even stronger, I think, increasing from last year, 45% of patients said they would have had higher satisfaction with their institution if they were offered more complementary therapies. And I know for anyone who's listening who works at a hospital, patient satisfaction is very important. So knowing that almost half of patients are saying I would have been more satisfied with more complementary therapies, I think is a very important note to take back to institutional leaders. All right, so next we're going to look at the communication gap. So this is probably one of my favorite slides in this deck. So the data I just showed about which one of these are you using any of them as part of your treatment? We went through that and scored, are patients using even one of those, any one of those 12 complementary therapies? And what we found was 2/3 of patients, 64%, used at least one as part of their cancer treatment. So that's pictorially described here in terms of the 64%. However, when we asked oncologists, what percent of patients do you think are using the integrative approach as part of their treatment? Their aggregate answer was 40%. So on average, they think 40% of patients are using it. And you can see that there's a pretty big disconnect there between physicians thinking less than half, and clearly more than half of patients are using it. So I think there's a reason for this. And it's not like anyone's fault. It's absolutely something that is just there. It's a fact. And it's something, though, I think we can do something about. So doctors aren't always asking. There's a lot of reasons why they don't always ask. Patients don't always tell their doctors. And again, there's a lot of reasons why patients don't tell their doctor, hey, I'm getting acupuncture, or hey, I went to massage therapy, or I changed my nutrition. But because doctors aren't asking and patients aren't telling, there is a communication gap, and therefore an awareness gap in terms of the physicians knowing how important this is to us cancer patients. So I'll wrap up here with barriers. I think I have about 5 more minutes, and I'll be turning it over to Dr. McManamon. I want to just show, this is a question we asked to patients and to doctors. So first, the patient view. what are some of the barriers that you patients have in terms of using complementary therapies or using them more if you're already using them? And the answers here are color-coded. You can see a little bit of the different categories here listed across the top. Lack of awareness, it's not a priority at my hospital, I'm not interested, or there's a cost or access issue. And really, all of them are kind of rising to the top. So education, access, and funding continue to be the largest barriers. So some of the top ones here in my health system didn't have them as an option, which is very common. I don't know enough. I need to be educated a little bit more about what they are and why it's important. And I don't have the money or access. I don't know how to get them. Are all very common themes that we hear. And again, work that we're doing to try to improve that. But what I think is really interesting is only 13% of patients said they have no interest in using more complementary therapies. So that's less than 1 in 5 patients. And that's significantly lower than when we did this research in 2022 in wave 1. But when we ask doctors now, same kind of question, slightly different choices for physicians. What do you think is a barrier to using more in complementary therapies? Their number 3 answer, a third of doctors say that patients aren't interested. And I really think that one specific barrier is just not true. I think they think it's true because there's this communication and awareness gap. But I think there's something that we could do about that then. We as patients could be more vocal and letting doctors know that we are interested. Now, there's other barriers here, which I alluded to at the beginning, like, well, health insurance doesn't cover all of these things. And I don't have staff on board, or even there's some down here about kind of a process to figure out how to get more complementary therapies to my patients. So I care about my patients, doctors say, and I want to help them, but it's not just me. There's a whole system involved here that needs help. I do think, though, one thing that's really interesting, one other piece of data about doctors is we asked them, do you want to learn more about integrative therapies, about the evidence base? And a whopping 85% agreed that they do want to learn more. So there's certainly an appetite from physicians to understand this more deeply, from oncologists, I should say specifically, and to be able to help their patients in different ways. So really quickly, just in terms of call to action here, how can patients, caregivers, and advocates help? Communicate if you're using these things or you're thinking about it. Certainly, please talk to your doctor. And there are some conversation starters in the appendix of this presentation, which Dr. McManamon put together, and they're really nice just for if you don't know where to start in terms of bringing this up with your doctor. There's some easy ways to go about it in the appendix. You can empower yourself. You can increase your own knowledge. There's a lot more than what I've said in this 15 minutes here. The Healing Works Foundation site has great resources. They have pocket guides that are really simple explanations, good practical recommendations, ways to find these things either at low or no cost. So definitely point you that way. And again, these are hyperlinks that you'll be able to access after the talk. And take action. If you are in active treatment or in survivorship, adopt these therapies into your practices. If you're a caregiver, help the people you care for adopt them. And caregivers, P.S., adopt them yourself, because caregivers go through a lot and really can do a lot for their own health and wellness if you look across that list. Small steps, like don't try everything at once. Try a couple things, see how you like it. Try it for at least 2 weeks, though, is my advice, to make sure that you're letting it become a habit. 4 weeks is even better. So I'm going to wrap up here just really quickly with my last slide about evidation. And I joined this company about less than a year ago, 6 months ago, because I really believe in self-empowerment and that people in general, not only oncology patients, but people in general can do more to engage in their health and understand it and track it better. So Evidation does have an app that helps people do that. It rewards you for healthy behaviors. It educates you about things like the example on this slide is nutrition. There's other things, exercise, the benefits of sleep, how to get better sleep, mental health. And it's used by nearly 5 million people in the United States. And we have several condition-specific experiences, and I'm working on building out an oncology one. Until we have the oncology one built out, though, I do feel like this is a good resource for anyone. Again, caregivers, family members, if you're in treatment or you're in survivorship, to improve your overall health and wellness. I talked about the content a little bit. You also get opportunities to join research. So that's clinical trials, market research, real world studies, kind of have your voice heard by the pharmaceutical companies and others who are finding new solutions for patients. You get personal health feedback. The example here is about step and sleep reduction. So I get feedback regularly that if I take more steps, I sleep better at night, which I know intuitively, but it's really nice to see that reinforced regularly through my app. And finally, you get money rewards for all of the engagement in the app. You turn points in for gift cards at the end of the day. So that's my plug for Evidation. Thank you for indulging me for a minute there. And with that, I'm going to turn it over to Dr. McManamon, who will introduce herself.
Thanks so much, Terri. And I'm so glad to be with you and everyone else here. And Terri and I got to know each other through something that'll be introduced later, the Integrative Oncology Leadership Collaborative that was sponsored by the HealingWorks Foundation. But who I am, this is part of who I am. This is not all of who I am, but you can see on the left that I am a practicing hematologist oncologist and associate professor at a local medical school here in Dayton, Ohio. And I've been interested in integrative kind of modalities and oncology for years and years. But I fellowship trained in the National Capital Consortium, which is just a very conventional program with a research year at the NCI and the Women's Malignancy Branch, and spent much of my career in the Air Force. I do want to say that for me, the green box is really who I think of myself as, and I come to you as a clinician, educator, education of medical students all the way to people in practice. And I consider myself a lifelong learner, and I'm here to learn as well. I also consider myself a writer, and my co-author, Dr. Wayne Jonas, and I came out with a book that came out last week called Healing in Cancer, A Guide to Whole Person Care, available on Amazon. And he's the president of HealingWorks Foundation. I just want to let you all know of that. It's really for cancer care teams to be able to understand how to provide whole person care if patients are asking for it, and of course for patients and caregivers. So next slide. Disclaimers, I do work for the US government. I kind of have my whole life. So my views do not necessarily reflect the position or policy of the Department of Veterans Affairs, and I have no other disclosures. Next slide. So I come here very inspired by actually the NCCS's definition back in 2014, 2015, when I was teaching medical students. At that time, I believe it was, someone's a survivor from the time of diagnosis through the balance of life. And that was something as an oncologist, a few years out of training, maybe 7 years out of training at that point, that I had never heard before. And it was very consciousness raising for me. It was the time of a push for survivorship care plans, and they weren't getting done. And so I started to, out of that inspiration, and learning more about survivorship and what it meant, and caring about my patients, I worked with medical students to try and bring them into that. What is important about this? You can look at this online. I'm not going to get into every detail, but what's important about this is the title, Survivor Stories Are the Teacher, Narrative Mapping and Survivorship Care Plans as an Innovation for Medical Students in the Pre-Clerkship Period. So my co-author, Marie Thompson, is a health communication PhD at Wright State University. And when I was talking about this project where I wanted to teach medical students how to use the electronic health record and let's complete these care plans, she said, where is the patient's voice? And that was really the inspiration, if we could go to the next slide, and really has set me on a journey that is much deeper than completing survivorship care plans for people and really trying to figure out, how do I care for people as whole people? And we all have a story. And here the medical students and the survivors of cancer shared their stories, their own health journeys in a narrative map format. And the quotes you can read in the call out box, the most important one to me was that the diagnosis or label of cancer is not the sum total of me, and survivorship is not just the absence of cancer in my body and mind. And that has stuck with me, right? It's the labeling and the languaging around cancer that sometimes really puts the barrier between the provider and the care team and the patient, so to speak, in this case, the person. And so next slide. At a larger level, we know that Cancer Moonshot, reboot, right? Their national goal is to cut today's age-adjusted death rate from cancer by at least 50% over the next 25 years. And also, another goal there to improve the experience of people and their families living with and surviving cancer. that's why we're all here. That's important because, let's go to the next slide. At the micro level, we want to really honor that it's whole people who are going through the process at a time of diagnosis and all the way through. And so I actually share this graphic with patients when I do an integrative visit to just kind of let them know that I am seeing, this as a way to envision what I am, what they are as whole people. People come to a visit, yes, maybe because there's something the matter, right? There's a cancer, there's a tumor, that's maybe within the body, right? But there's all kinds of layers to each of us as a person. And so people can conceptualize this very easily by looking at this, and it allows us to talk at all the levels. So yes, there might be something the matter, but also what matters to you, and what matters to you at the spiritual and mental level is as important as what matters to you at the body and external level, if you say so. And so it really opens up the conversation to allow people to be heard in all the ways that they present. Next slide. So just to zoom back out to the big picture of whole person care, all the work that NCCS and others have done, and I'm looking at the larger national trends and guidelines outer circle, particularly if we talk about associations such as the American Society of Clinical Oncology and their partnership with the Society for Integrative Oncology, getting together and putting out actual guidelines of how do we provide more integrative care services with evidence informed, as somebody put in the chat. So what's the evidence behind these different integrative modalities, so that an oncologist who says, I need more education about integrative oncology, actually has something to go to and say, well, what is safe and has evidence of benefit, and what is safe but has, maybe no evidence of benefit, but the research isn't there, but it's safe. They can then get behind patients asking for and maybe adopting some of these practices. Outside of that, or inside of that, the supportive care services, these are the groups who've always been pushing to have whole person care. They've always been approaching people as whole people. So not just, palliative care on the outer circle, but then all the people like the nutritionists and the physical therapists and the psycho-oncology providers who've been pushing for this, like social workers have been pushing and providing whole person care in a holistic way for a long time. And so just knowing that all these groups are coming together over time to make something happen, I think is encouraging. We are going to talk about the self-care aspect. And so that sometimes is the low-hanging fruit that we just don't even engage with people about, even though we know it can make a big impact in their ability to tolerate treatment or to recover from treatment. And how do you actually have those conversations? I think, in Dr. Jonas's work in primary care, he would say, well, that's, potentially at what's called a HOPE visit or an integrative visit, which is HOPE standing for healing-oriented practices and environments. Having a conversation with a person about all the layers of their health and saying, where do you want to work? Where is it important for us to support you? And how does that look in your actual life? And we are looking at engaging and empowering people by having that conversation. And so I just want to kind of have that big picture that there's a lot of people moving to try and make this happen. Next slide. So in the realm of oncology, what is whole person cancer care? Because you can have whole person primary care, you can have whole person neurologic care. But in whole person cancer care, as was shown on Terry's earlier slide, conventional medicine does not fall out. If you're being treated for cancer and you're choosing conventional medicine, that is the backbone of what we're doing to treat the tumor, right? To treat the clone or whatever it is we're dealing with. And then the non-drug and complementary approaches that, have some data behind it that people can actually engage in depending on, all the factors that you guys have been bringing up in the chat. And then the self-care part, having that be as heavily weighted and as important as these other features that are shown. And so kind of the nexus of everything is whole person cancer care. For me, this is a breakdown of these barriers of like nomenclature, like integrative, and we're getting past that to say, what is all of this together? Does it have to be so barriered? Next slide. So I'm going to share some case examples. This first one, somebody in the chat was mentioning support groups, or that it was surprising that there were few support groups maybe on, utilized in the survey by groups of cancer survivors. But this was an elderly person who is still on immunotherapy and who advocated at an outside health system for a support group to occur. And with a social worker, started a support group and really was the only member, like it never got off the ground. And this person was very frustrated by that and actually changed health systems And again, got to a place where there was no support group present, and found a staff member who, who could potentially make that happen. And together they did start a support group, which then enrolled other people, and it actually grew as a support group should. And what's happened here is that this person, now 2 years into this process, past their due date from the side of the, cancer diagnosis, so to speak, is really inspiring other people to both get into this support group and to stay into it. And shared with me that, people cited, that individual as the reason that they were there. And, I think that's the power of community, and also the power of people knowing inherently what would be healing for me, right? And then the fact that this person made it happen after 2 tries, I'm really, really inspired by this story, and just the community that was built and that continues to go on. Meaning that if I tell you about the next person, this next person is a member of that same support group, and wouldn't have been if this support group hadn't started, of course. This person's on chemo immunotherapy, and has tried lots of different modalities through integrative visits initially with me. And she's graduated herself from medical massage, kind of felt like it was helpful at first, then it wasn't helpful and stopped that. Tried Tai Chi and didn't like it. Experienced relaxation from a guided imagery session that we did just together for over, a 10-15 minute period within just a visit, and felt relaxation in the moment. Not that she's doing it at home, but that was something she was willing to try. And really what I've seen with her is that she's been empowered to pick and choose modalities, and there's no blame or shame if something doesn't work. It's kind of like, I'm just watching this unfold with her. I'm just offering, what has data, what's safe, and seeing what works for her. Next slide. This young person has been through, the ringer, all the things, the surgery, chemo, radiation, hormonal therapy, and over time, had to find a way back to what in this case was femininity. And really, the point I want to make here is that we actually had a lot of discussion and challenge about sleep, that was really something that was missing throughout all of this and very difficult. And, I am oftentimes one of those who's really quite, let's talk about the blue light. Let's talk about, the nighttime exposures to things that are going to suppress your melatonin. How do we, help you with that? And really coming to sleep hygiene with her, I will say she took it like one better. And that's what I've seen with a lot of these visits, is that I'm learning from my patients. So, I might have said, well, try these blue light blocking glasses, let's see if this will do something for you, because it's not going to hurt, right? And she had the means to spend the $30 or whatever. And, she did one better and actually went home and said, this is affecting my partner too. And, we love to watch TV together. And she bought something I didn't know existed, which was a giant film that you can put on your 54-inch screen TV that blocks the blue light. And for them, that was a solution that actually mattered. And so I just have to be really humble and say that this is having conversations where you don't know everything, but you know enough to guide somebody, is, I think, integrative oncology. Whole person care is even broader than that. And so the last person I want to share about is somebody with stage 4 cancer. This is a diagnosis that's not highly survivable typically. And this person, despite that, has been, they live alone. They've been self-advocating the whole way through, building a very multi-pronged team, multidisciplinary, mental health support, integrative visits, palliative care services, seeking second opinion, of course, for potential clinical trial. And then, really taking total responsibility with a lawyer for estate planning and all the things. And just watching this person go through, I think for me has just been very instructive, that the team approach and really all hands on deck, and having somebody who is empowered themselves to say they deserve all of those things. And if they have access, they're going to have that. That's been instructive to me. So I'd like to go to the next slide. If you're here as a caregiver saying, what can I do? I mean, I think caregivers can tell caregivers probably better than I can tell a caregiver what to do. But we know that if you're here, you're probably interested in being an advocate, or looking for how to do that. And so acting as an advocate for the person you're caring for, of course, is important. And part of that is just the simple things that can happen, with the transportation and the taking of the notes and those things, getting people to the treatments and understanding the treatments. But to increase knowledge base, which I think we're all looking to do, Healing Works Foundation does have whole person care pocket guides about these different modalities that may or may not interest the person you're caring for. But those are available for education purposes. And then asking, of course, for help when you need it, and looking for free options. I feel like putting anything on caregivers or patients is always difficult, right? Because there's enough to do with just dealing with the appointments and whatnot. But if you're looking for things to do, I would suggest the last bullet is quite important, which is to share your story with the Cancer Moonshot. From what I can tell from their website, they're asking for people to give input. And I think good, bad, or otherwise, like, those stories are important and they will inform, hopefully, change over time. And so I invite caregivers to potentially do that. As a person during treatment, again, as the survey results showed, we may or may not be talking to each other. And if you haven't told us what you need or what you're currently doing, and it would make you feel better to do that, then please do. I think people should be given avenues to provide anonymous feedback to their system, their health system. And if there isn't a comment box or a way to do that, you can figure a way out to do that if you're motivated, because people do read those when they come through, and it does make change. But I know people are vulnerable when they're being treated. And so if it can be done in a way that makes you feel safe, I would encourage it. And we talked about advocacy. And then as a person post-treatment, again, the idea of telling your story, increasing the demand for integrative oncology is, part of what I think Terri's work is about. All those people in the survey were post-treatment, so they were looking back, at what would have increased their satisfaction, what would have made more of a difference. People who are ready to tell their story can certainly join patient advocacy groups. And this group here is a very activated group that we're speaking to today. So, again, you're going to know as much about that as anyone else. But you can serve as a voice, a patient voice on a board. And if they don't have patient representation, if your schedule allows and it's your interest, then those things can occur. I think a lot of times, just like the health communication PhD said, like, where is the patient voice? Like, we're getting better at hearing that. But I literally would have taken that project with the students all the way to like a poster, and it just wouldn't have had the patient voice. Like, I still could have done that process. So you can hear, like, it really matters if you see the patient voice is not there, to say, where is the patient voice? And then also increasing knowledge with pocket guides. Next slide. So what can systems do, and what can clinicians do? So from the system side, again, a lot of this is going to come out. This is the financial payer side. This is where CMS is trying to put forth, how do we do like the enhancing oncology model, where we have practices enrolled, to see how do we get toward, is there more value in providing this type of care? Bundled payments and value-based payments, that's really going to be the way to go if we're going to get this more financially feasible. Just fee for service has not done it right. But in the CMS enhancing oncology model, the practices enrolled are basically trying to leverage the electronic health record to say, how do we give patients and caregivers 24/7 access to the care team? How do we get questions answered so people don't end up in the emergency room and don't need to end up in the emergency room? And how do we actually use patient-reported outcome measures, or PROs, to inform the care that we're giving? So how do we impact things that actually matter to patients based on their input? So those are, things that are changing slowly, but they are changing. And I think that's important. Not every practice is engaged in a CMS enhancing oncology model, but if you're looking for care, you could certainly check for one that is enrolled. Team-based care is where it's going for systems. And I think most people who are in administration know that. And certainly for us who are on the care teams, we're trying to learn how to be team-based care members. And then the places that do whole person care or integrative oncology often do tap into philanthropic and other community-based funding sources. So that's just the reality. As a clinician, one way that's really practical is, if you're interested in impacting whole person care and you have an interest and you want to talk about nutrition, you want to talk about movement, you can do that in a group visit format and bill for, if you've got 10 people in the group and you spend 1 hour, you're going to bill for 10 people, right? For 1 hour. So it's a very efficient way to get what they call relative value units and get those billed out. And so there are groups that teach people how to run integrative medical visits or group visits, and there's papers on that out of UCSF. Donald Abrams, MD, out of the Osher Center, has a nice paper about that and how the billing was very important there. And then really simple for a clinician, any level of clinician, ask a patient what matters now or what matters today. You know, that makes such a difference. I think sometimes we just don't even know what matters, and that is the first step into really meeting somebody's needs. If the patient dignity question is not something you've heard of, you can ask the patient dignity question. What do I need to know about you to give you the best care possible? What do I need to know about you as a person to give you the best care possible? No doctor has ever asked that to me, but if they did, I think it would help them provide better care. So I can imagine it would for others as well. And then for people who are in practice, really having a go-to, like a resource mapped tool of what are the integrative providers in my community that I can refer to if, say, somebody comes who has the means and wants to know about how to go see an acupuncturist, say, who do I refer them to? And that requires you actually having some sort of built list or having spent some time with your team trying to map that out. And so that is important. How would you do that? Certainly you can look for community or system-based offerings, but you can also try modalities yourself. You know, heal the healer sort of situation. If everything's not perfectly functional in mind and body for a clinician, it's important to try modalities that might help you. It can end up helping your patients if you actually, you know, have a personal experience with something to recommend. And next slide. So free and low cost options. I mean, I think people in the breast cancer world certainly know about Unite for Her because they do fund self-care grants through their work. And for, you know, I don't know that it always has to be cancer specific in terms of these not-for-profits, but that is a source of funding. It does take time to look for those. Employee wellness benefits should be tapped into, of course, for people who are insured through their employer. And then free modalities are always there and always something that I talk about because I don't want that barrier. And these are oftentimes foundational things that can actually help symptoms that people deal with on a daily basis, which is oftentimes anxiety, oftentimes fatigue. These are things that if we don't have these foundational things right, it's hard to add additional layers to what we need to do today. Of course, people know to tap into their circle of support. I always refer to free online programs for people who have access to online web-based services, because you don't have to be a patient at Inova to have access to their Life with Cancer programming, which combines everything from movement through support group type stuff. Smith Center in DC, again, you don't have to live in Washington, DC to tap into their free programming online. And then community organizations are always on the list, the group medical visits as talked about. And then for patients or survivors and caregivers who are very activated and want more information, want access to what their providers are learning about in the conventional realm. Of course, being a patient advocate member of ASCO, for example, that gives you free online meeting attendance, availability to the ASCO annual meeting, which is every June. And then the SIO, or Society for Integrative Oncology, does have a patient advocate committee, which I think Terri can probably speak to that better. I don't know that they give you anything free for that. Next slide.
Sure.
These are things that were developed out of the Integrative Oncology Leadership Collaborative and the work of the team at HealingWorks Foundation, particular to whole person cancer care, that are free resources. Again, this is into the education side of how do I ask about this, or what is this, or how do I bring this to my provider? The first thing is a 3-minute video, 3.5-minute video that just is an overview for someone trying to understand what whole person cancer care is by Dr. Jonas. And then there's an ebook as shown, and a 12-part email series that will send information from the pocket guides on different topics if somebody's just trying to get education. Next slide. Again, those resources were vetted through and adapted from, in some cases, adapted from the primary care whole person work that the HealingWorks Foundation's been doing. And who was actually helping to adapt those things were people from these different centers here as listed, who were members of the Integrative Oncology Leadership Collaborative that went on for 18 months and that Terri was a part of as the patient advocacy and empowerment collaborative member. Next slide. So who's pushing for more whole person cancer care? You know, if you look in the mirror in the morning and you showed up here, it's probably you. I know, you know, that's why we're here, and I really am glad to be able to speak with you today. Next slide. For your care teams who are looking for additional learning, the oncologists who want more information, this is an access point, which is the Healing in Cancer book that we mentioned. Also, there's free CME or continuing medical education for physicians and nurses through a collaboration of Healing Works Foundation and Tufts University, that whole person cancer care course. Those are all available on the right side online is free. Next slide. Great, we're ready for questions.
We made it to questions, Veronica. I see there's so much that's come through the chat.
I just want to do some housekeeping. Also, some things that were popped up in the chat. Know that we on our website at National Coalition for Cancer Survivorship, on our survivorship checklist page, have a page dedicated to integrative oncology. And we do feature those wonderful, wonderful, wonderful pocket guides. So you can find them there. See some of our advocates who also, this is a very tight community from the Society of Integrative Oncology, that patient committee, have done some multimedia videos about what integrative oncology has meant to them and improved their quality of life. So feel free to check out that resource that has many of the resources that you talked about on our website as well. So I just want to start off by thanking you both for joining us and sharing this wonderful topic. So I do have, so something that jumped out at me when you asked what is integrative oncology, there were quite a few that used the word alternative medicine. And so I just want to give you two the opportunity to distinguish between integrative and alternative. And what do you suggest for people that think that it's an alternative to practice?
So I'm pretty passionate about that one, Dr. McManamon. I'll jump in. The old term is CAM, complementary and alternative medicine. That was used for many years, decades even. Personally, to me, it's always the and. So alternative itself means you're not using the medical treatments, or at least not the way your oncologist is recommending. You're instead using something like supplements and nutrition and exercise. I don't agree with that personally. I think the medicine is very important, and that's, again, just my personal opinion, but there is a big difference between, so alternative means no medicine or no medical. Complementary means you're adding those kind of therapies to something, complement, and integrative is the addition of the medicine plus the complementary therapies together. And Alyssa, anything to add to that?
No, just that if somebody decides to go for alternative, that the door does not close, that it doesn't mean that they can't come back and reintegrate right into into conventional care and so I just really honor that everybody's on their own journey. And so, but I would agree that alternative means they're typically eschewing or kind of putting aside conventional means. And for the time being, and that may be forever, or that may be for a period of time.
I will say there's a book called Radical Remission, which is all about alternative, and it's very inspiring. I took away from it the Medicine Plus, but I recommend that as something for cancer patients as well to understand more about whole person care.
Absolutely. And to kind of piggyback off of that, this question, would you call, when patients are using complementary therapies, but the oncology team is not aware, is it really truly integrative? And how do we help patients and care teams understand this distinction to really create an integrative approach to treatment?
Yeah, I appreciate that question. I saw that was from, I think, Laura Pohl, who we know. Thank you so much, Laura, because it's such a great point. How can it be integrative if we don't know about it? And I think that's the part where, well, people have experiences with the medical system where they brought something to a provider and it was ignored, or it was like I don't know, it was like asked about and then it was like, no, and so people stop bringing things sometimes because they might have had an experience. And so we're just trying to say, yes, that actually we want you to be brave. We want you to try and have conversations if it will have your care be integrative, which means that all parts of your care can work together better. And I think, how do people do that when they've had an experience where it was like, no, don't do that, or, I don't know anything about that? Well, it takes some bravery to like say, well, last time I asked you about something and you didn't really seem to respond. Like, is there anybody on your team I can talk to about this? Like, who else on your team? Not even a yes, no question. Who else on your team can we bring this to? Because this is really important. And I'm not sure I have my question answered. I think also bringing things to providers like in hard copy can be really important. So if you learn something from a pocket guide that seems to have evidence, for example, from Healing Works, and you want to know more about it, and they don't know anything about it, bring it to them in hard copy, because people can't ignore things they're handed. And I really just encourage people to, I don't know, to not give up. Like my guy with the support group, I'm so inspired by him. Go ahead.
Okay. So again, that kind of jumps into, how do you as a provider, the burden of almost vetting programs? What is a good quality program? What is not a good, what should you be referring to your patients to in the community? What level of that is on you as someone who's doing the referring? But also, when we were talking about the list of potential things to refer, there was yoga therapy. Is there a difference between yoga therapy, for instance, and just a yoga class at the local fitness studio? What is a way to distinguish between integrative modalities and things in the community that do support survivors?
Yeah, there's definitely a distinction between yoga therapy and regular yoga classes, and people do additional training. YTT is yoga teacher training, so people will have the number RYT, registered yoga teacher. They'll have the number of hours behind their name, so to speak, or you could ask about that if you were an individual wanting to know more about your teacher's credentials. But yoga therapy is much more specific and oftentimes can be one-on-one. And so I don't know the name of the body that I would actually do a Google search, and I've done yoga teacher training for the 200 hours, so I know about basic yoga. But for yoga therapy, it's an additional sort of certification, in my understanding, and I would go to the websites that seem to deal with that on Google to understand more about how do I find out if a provider. They probably have registered providers who are yoga therapists.
Perfect. And I agree, Dr. McManamon, there is a distinction between yoga therapy and yoga. And I think part of me though too says, like, doing something is important. So do some research if you can first to find true yoga therapists, ask your providers, listen to your body. Like if you end up, that's a dead end and you end up in a normal yoga class, there are modifications that you can make as well as someone going through cancer treatment. And actually the Society for Integrative Oncology has some good healthcare professional facing materials about that, that are kind of already out for pain management and are coming out very soon for depression and anxiety management among cancer patients.
So of course, the hot question in the chat has to do with funding, and I do know that you laid out where foundationally supporting patients with modalities that don't have a cost. What is your opinion on? Can you talk more about reimbursement changes that are needed to make integrative oncology more accessible?
Yeah, I think it's about the evidence-informed part, because no insurance company is going to pay for something that doesn't have evidence. So that's where research is really important. So if people are trying to figure out, how to move the needle, usually has to be based on evidence of some flavor. And so to get things covered, I think that's important. I mean, I work in a system where everything that was on the list in the lower part, where there were the less used modalities in Terri's slide, where everything like that is covered. Medical massage is covered, Tai Chi is covered. And guess what? Like somebody put in the chat, time toxicity is what stops people from getting to a lot of these things. You can have everything covered, and it's like in the midst of life, it's very difficult for people because of transportation, having to be employed, all these things to get to these things. So It's so interesting because I work in a system where you would think the panacea has arrived, which is the form of everything's covered, and yet it's not. And so doesn't mean that this is an important question, but I do think part of it is the research base, and that's why the research that's been done is important, and we should continue to look at that evidence base. Those guidelines are going to help,
Yeah,
especially
that's what I was
for
gonna say.
like the acupuncture should be covered for, aromatase inhibitor induced arthralgias. Like, to me, that would be a no-brainer, but I don't work for an insurance company. So,
So we need the data, the guidelines, which are being updated, and then the advocacy, which I know NCCS does a lot for that in terms of like policy change, and that's going to help with the funding as well.
Absolutely. So one last question, and I'm going to pose it to Terri, and then we'll wrap up. What is your advice to patients on this call that are struggling with late and long term and are curious about integrative oncology? What would be your advice to them?
One step at a time, deep breaths. That's always my first advice to people. It's important to keep your mind calm. I think we've presented a whole bunch of resources, and I've seen a lot more in the chat too, free resources. I ask myself, am I paying attention to my mind and like my stress levels? That's a big thing. Am I paying attention to my body, how I move it and what I put into it? And am I paying attention to my social connections, whether that's religion or nature or just people in your community? Those are the three things that I focus on. So I would say take a look at those and see where you need to reinforce.
Okay. Thank you so much for joining us today. Thank you to our audience for joining us for the conversation, and check out the resources and you'll have them in your inbox. Have a good day, everybody.
Thank you, everyone.